Good morning, ladies and gentlemen. Welcome to our webinar. We're just waiting to officially start, so we give colleagues time to connect, maybe a couple of minutes, then we'll be on our way. Thank you. Good morning, once again, ladies and gentlemen. My name is Simbasvanda. I'm with FANAPAN, based in Pretoria. I'll be your facilitator this morning. We're going to start now. Perhaps, Kanto, you can just put on the screen our program, just so that everyone can know what we expect to cover this morning. Okay, so we have a fairly straightforward program. We're going to start off with some welcome and opening remarks from the CEO of FANAPAN, Dr. Chilidzi Matsivandila. And this will be followed by a presentation, welcome and presentation on the overview of the CaBFoodS-Africa project, which is basically sponsoring this program, the study that we're going to be sharing on. And then Dr. Alice Murage, who is a country consultant, will make the presentation on the findings on the country study on the nutrition sensitivity of food and nutrition policies, strategies, and programs for Kenya. We will then follow this up with some discussion and finish off with some recommendations and way forward. It says there Francis Hale, but unfortunately Francis is a bit indisposed. He's online, but he's lost his voice. So Dr. Njo Nyoni is going to stand in his place. That's my colleague in FANAPAN, who is the manager for capacity development program. So without further ado, I'm going to request that Dr. Chilidzi makes his welcome remarks so that we can start our program. Dr. Chilidzi, over to you.
Thank you so much, Prof. Sibanda, for the introductions and also for facilitating today's session. Let me start my welcome remarks by sending acknowledgements to our partners. The project is under the leadership of Africa Research Universities Alliance, ARUA, Center of Excellence in Sustainable Food Systems, which is ARUA SFS. So we are implementing this then together with our academic partners, the first one being the University of Pretoria. We are also in Ghana partnering with University of Ghana, Legon. In Kenya, we are partnering with University of Nairobi. And overall, we are also partnering with Rufora. Let me also acknowledge my colleagues from Fanapan, but more so than acknowledge our node hosting institution in Kenya, which is Kipra. But what I need to underscore before I go into giving a bit of context is that the project that we are gathered to talk about here today, it really then aligning to the Fanapan 2016-2023 strategy. And towards the end, I will outline in terms of how this alignment is structured. So to contextualize my welcome remarks, let me share a bit about the state of our current food system in Africa, but also then I know that this also talks to the situation in Kenya. Our food system, we know that is not functioning. This is evidenced by high rates of food insecurity and malnutrition, which we know the statistics. This is compounded by the challenge of climate change and variability. This is putting heavy pressure on already challenged system. The third and the other new situation which is facing us in terms of challenging the food system was the COVID-19 pandemic. This is also then challenged more by the global and regional conflicts that we are starting to witness. And this, in essence, is disrupting the production and supply chains. And therefore, if these are not functioning the way they're supposed to function, it means that those people who are supposed to be benefiting from what we're delivering, for them to have a sustainable food system, it means that we are failing to deliver on our mandate. So ladies and gentlemen, you will agree with me that the challenges that we are here to talk about, we normally call them that they are complex, they are wicked, and they're interconnected. So when we talk about climate change, food and nutrition insecurity, COVID-19 pandemic, regional and global conflicts, we cannot attend to one, but we need to attend to all of these issues. So given this backdrop, then what I need to present here is that what we are here for is to make sure that we build capacity to deliver for Africa in terms of making sure that we are having a food and nutrition secure Africa. And two, we are having a climate resilient food system for Africa. And therefore, to do this, which is central to the project that we are here to discuss on, we know that individual and institutional capacities to implement policies, strategies, plans, and programs is very important. And therefore, we really welcome you here today to fully submit in terms of what we're going to share with you. So in terms of why are we gathered here today, the main issue is that we have conducted a scoping study in terms of which programs are there, which policies are there, in terms of which frameworks are relevant in terms of the work that we do. However, what we need to do now is to reintrospect. And therefore, this opportunity today provides an opportunity for us to introspect and ask some questions around this study. That is, we want to fully appreciate what is the state of food and nutrition policies and accompanying interventions. And therefore, when we are reflecting, when we go to Q&A, the main question we really need to reflect upon is to what extent are our food and nutrition security policies, strategies, and programs fit for purpose. More often we design this, but we never test in terms of whether they're relevant or fit for purpose for today. We want to make sure that we really then interrogate the fit for purpose of these strategies. So we have implemented this work in Ghana, Kenya, and South Africa, but what we need to introspect upon is the evidence from Kenya. And we examined these policies and frameworks in terms of the dimensions of food and nutrition security. And for information, then these are availability of food, access to food, utilization of food, and also we have looked at the stability, sustainability, and governance of food systems. But while we are doing that, we also know that we will not be having a complete overview of things if we don't also look at the issue pertaining to gender, women empowerment, and how are youth engaging with these processes. So the capacity gaps that we are going to identify, or that we've identified, then will help us in terms of trying to inform policy revisions, practice and further research, which is required for us to deliver our mandate as partners and more so as FANAPAN. So now going to conclusion. I have spoken about that the project is aligning to FANAPAN mandate and is doing this in 3 ways. First, we do policy research and analysis. So this piece of work also assisted us then to deepen our game in terms of how then do we do better in terms of generating evidence, which is research-based in terms of our African food system, which is requiring some transformation. The second element is that the convening that we are doing here today is also talking to our policy, advocacy, and engagement. And we are glad that you are attending here to give your perspective, representing the stakeholders which you are bringing to the table. The third one, which is very critical and is at the heart of the project, is that we are also then engaged in capacity strengthening. And this project is about to build the capacity in terms of how then do we generate evidence and people who will help us to advocate from the demand side in terms of how then will people who are praising this evidence are able to do that. The main thing that we need to ensure is that this project is building into making sure that we strengthen capacity of stakeholders, both state and non-state actors, to effectively implement policies and programs. Without any further ado, I wish all the presenters, all the participants a successful round table. I urge you to contribute. We are here to make sure that the study is benefiting from your insights and therefore, please assist us in doing that. Prof. Sibanda, then back to you. I think I've delivered my opening remarks.
Thank you, Dr. Chilidzi, for those opening remarks, which give us a background as to the context within which this study was conducted. We're now going to invite Prof. Hetty from the University of Pretoria to give a welcome remarks as well as give us an overview of the CaBFoodS project, which is, of course, under which we implemented this study. Prof. Hetty, over to you.
Thank you very much, Prof. Sibanda, for this opportunity to speak today and to give you a little bit of a background about this 3-year project that is supported by the UKRI and the African Research University Alliance appointed the University of Pretoria. We were successful in obtaining a bid to host a Center of Excellence in Sustainable Food Systems for this past 3 years. And I would like to acknowledge Professor Lindiwe Mayele Sibanda as the director and also Professor Frans Swanepoel as my co-director. And this project was successful with the University of Pretoria as the lead, but supported by the University of Nairobi and the University of Ghana, Legon. Next slide, please. So our vision is to harness partnerships in research and innovation to drive agriculture and food system transformation to ensure sustainable food security and nutrition in Africa. And as Professor Dr. Chilidzi very aptly noted, is that actually our food system is failing us at the moment. And so our purpose in particular during this project is to build a critical mass of researchers conducting cutting-edge research, of which I'm sure we're going to hear more about today, specifically as we focus on Kenya, and to generate global recognition of African scholarships, as well as to engage with stakeholders at grassroots and policy levels. Next, please. So we have 5 focus areas in which we are doing transdisciplinary research. First of them is to improve Africa's herds. Second one is unleashing the potential of African crops. The third one is on safe, nutritious, consumer-driven food. The fourth one is on evidence-led food policy. And the last one is on climate-smart food systems. Next, please. So the CaBFoodS, which is one of the, stands for the capacity building for food security in Africa, particularly focus as one of the two flagship programs under the Arua SFS. And it will come to an end at the end of August. And we will having science days at all three of the institutions to celebrate the closing of this capacity building grant. But we do know that there's a lot of sustainability that's built into the fact that all the results of the research will also be published. Next slide. So the purpose of this specific grant is to build intellectual capacity to do intellectual exchange and capacity building, but also to focus on postgraduate training to talented students, sharing academic resources across universities. And we have 5 themes. The first theme is to build capacity in food security following different approaches. And we particularly had hosted different short courses in that. In theme B, we look at retaining nutrient quality through complementary interventions. In theme C, we partnered with the SRI conference that was held a month ago. We focus on big data science through the lens of agriculture and food systems to build much needed skills. And then theme D is on policies for optimal nutrition and sensitive options. And the last one is in a high-level colloquium on ending hunger. Next, please. So just to highlight that this is theme D, where we partnered with Pan to look at the policies for optimal nutrition and sensitive options. Next, thank you. So I can just say that some of the highlights are that we have collaborative agreements with not only our partner universities, but also with Pan and with the Bureau for Food and Agricultural Policy. We currently have 10 researchers that are conducting research in the 3 focal countries, and we have trained up to 115 participants from 11 African countries to date on with these short courses. We've hosted a safeguarding seminar with 8 presenters from the University of Pretoria and the University of Ghana, and it will also be institutionalized within the universities as part of new personnel that is appointed at the university. So we feel that is quite a good sustainable outcome. And a total of 55 participants from 8 African countries representing 13 institutions attended the safeguarding seminar, which is part of the requirements of a UKRI. And then I just want to say we look forward to hearing the report today. Thank you.
Thank you. Thank you very much, Prof. Hetty, for that overview. It gives us an idea of where to place, this project that supported the study. And we hope that everybody will find the information from this webinar, useful. And we're looking forward to some dialogue with everyone, particularly our colleagues from Kenya. Without further ado, I'm going to be asking Dr. Alice, who did this study, to make a presentation on the nutrition sensitivity of the food and nutrition security policies, strategies and programs in Kenya. Over to you, Alice.
Okay, thank you so much, Prof, for this chance. I hope you can hear me.
Yes, we can.
Okay, so I'm going to give this presentation on the Kenyan case of the project. Can move to the next slide. So the presentation takes that outline. There will be a background on food and nutrition security, in Kenya, objectives of the study, methodology, study findings, summary, and recommendations for policy, practice, and research. So on the background, I will start by saying that the issue of food and nutrition insecurity in Africa has been of major concern over time, and this has been due to the triple burden of malnutrition, micronutrient deficiencies, and also the cases of obesity and non-communicable diseases. Globally, we realize that there is a lot of people, over 3 billion people, cannot afford healthy diet, according to various studies that have been conducted. In Kenya alone, we have over 10 million people who suffer chronic food insecurity and poor nutrition. In fact, in one of the policies that we have reviewed, that is the National Food and Nutrition Security Policy, the statistics show that about 30% of Kenyan children are classified as undernutrition. So in this case, it shows that we are far from reaching the food and security. We are yet to achieve this food and nutrition security for our country and even in Africa. So what do we need? We need to have new actions on how to produce and consume, like a new paradigm shift from the way we are producing our food and the way we are consuming our food. We need to put more emphasis on nutritionally diverse diets, and also to encompass the food security, looking into all the dimensions, that is the availability, the accessibility, utilization, and also stability and governance. Next slide, please. So looking at the Kenyan case, about this review, we wanted to see how the government has made efforts in coming up with policies and strategies and even implementation frameworks to secure food security for the nation. And this has been done. From the review, you realize that Kenya has made a lot of strides in coming up with the suitable policies, strategies, and even implementation framework. However, the implementation of this has not been easy. It's been a challenge. So we have good documents, but the level of implementation is still very poor. And this has been attributed mainly to inadequate resource allocation. There hasn't been very good allocation of resources. The budget is limiting. There has been weak coordination between the sectors, one ministry and the other. The coordination has been very weak. Of course, the issue of climate change has affected the implementation, because you have to keep on coming up with new strategies when there is a climate shock. And recently, the COVID-19 worsened the situation. All the efforts has been done, but this was actually like put to zero again due to the COVID-19. So for this reason, the poverty level, food insecurity continue to persist within the country and within Africa. Next slide, please. Next slide, yeah. So remember last year we had the UN Food Summit, which recommended the use of sustainable food system approach as a way of trying to achieve food and nutrition security. We also need to prioritize our interventions so that we have nutrition sensitive approaches, which can ensure that we are achieving our objective of attaining food and nutrition security. We need to equip our food systems to deliver safe, affordable, and nutritious food for all. And more importantly, we need to have very strong institutions for effective implementation of food and nutrition security policies. Next slide, please. Now, what was the aim of this study? Why was this study carried out? And I think it has already been alluded by the person who opened the meeting. We needed to carry out this study as part of the project to understand the food and to have a situation analysis of the status of the food and nutrition security policies, strategies, and programs in Kenya. What has been done already? What are the existing policies? What are the existing strategies and programs, and probably their level of implementation? That was a general objective of this study. But specifically, we needed to find out whether these policies, strategies, and programs, if they're existing, at what are they following the food system approach? Number two, these policies, are they gender sensitive? Are they sensitive to vulnerable groups, like, for example, women and youth? And what are the main gaps in these policies? So despite just reviewing the documents, we also needed to allude whether they are answering to these questions. Next, please. So to review these policies, basically the whole study was about the desk review of all the policies, and also to triangulate this information, we did some key informant interviews with some government officers and people who are involved in policy development. But more importantly, when we were reviewing this study, we used a checklist, or we adapted the checklist from the FAO guiding principles for nutrition sensitive agriculture and the dimensions of food security. So as much as we were reviewing, we tried as much as possible to follow the guidelines of the FAO. And this one helped to see whether the policies and the program add value to the different dimensions of food and nutrition security, as I mentioned, the 4 dimensions earlier. More importantly, as we were reviewing, we were also trying to see whether these documents show any opportunity, or is there any opportunity that is being created for the women and youth, and of course the other vulnerable groups. Next, please. So the review, we reviewed about 18 documents, about 4 policies. The others were strategies, plans, and implementation framework. The 4 policies that we reviewed, one was which was the National Food and Nutrition Security Policy 2012. We reviewed the Kenya Health Policy. We reviewed the Kenya School Health Policy and the National Maternal, Infant, and Young Child Nutrition Policy Guidelines 2013. Just to put a rider that this is not all the policies we have, but these are the ones we felt were answering to the question of food and nutrition security. Of course, we have other policies that can be reviewed, but we identified these 4 as the main one which were addressing the food and nutrition security policy. On top of that, we reviewed strategies like food and nutrition security strategy, which was drafted in 2008, and which actually is the one which is part of the implementation of food and nutrition security policy. We reviewed the ASDTS, which is also part of the implementation of the food and nutrition security policy. We reviewed the National School Meals and Nutrition Strategy and the Kenya National Strategy of Prevention of Non-Communicable Diseases. Next, please. I have a whole list of the policies that strategies that we reviewed there. I don't want to read all of them, but in total, we reviewed 18 documents. We have the Vision 2030, which of course is a blueprint of the of Kenya economy. You have the Big 4 agenda and other policies and strategies that are ongoing and which we felt are answering to the food and nutrition security policy. I would say this is not all of it. There are other security policies. There are other policies and strategies in Kenya. Yeah, but basically that's what we reviewed. Next slide, please. Next. So these are the findings. While reviewing those documents that I've already said, we tried to look at the 4 dimensions of food security. And as I said earlier, we were following the checklist from the FAO, which has set some priority areas to look at. So while reading this document, we were trying to look at, are they answering to these priority areas that have already been set? And in terms of the first dimension, which is food availability, There were 5 priority areas, and one was to facilitate increased and sustainable production of diversified nutrient-dense crops. And this includes the indigenous and orphan crops, legumes, fruits, vegetables, and also livestock. So looking at that and the guiding principles, we realized that out of the reviewed documents, about 50% of them were answering to that. 9 out of the 18 reviewed documents had actually were addressed that issue, especially the issue of biofortification of domestic production, the issue of intensification of production of nutrient-dense crops, including the vegetables, fruits, and livestock, the issue of production of traditional crops, use of homegrown nutritious food for school feeding programs. All those were addressed, were addressed actually in about 9 of 18 documents. In the other remaining documents, some of them had partly addressed, but some had not mentioned at all. So one of the gaps that we identified was the issue of urban and peri-urban agriculture. Although we have a lot of food insecurity in the urban areas, there weren't many interventions that have been mentioned to address this issue. Also, the issue of access to credit for inputs, the issue of financing and insurance schemes for farmers was also not really mentioned, though they are part of the priority area set by the FAO. The other priority area that was given was maintenance and improvement of natural resource base. Again, out of the many documents, only 3 of them had addressed that issue. Can I say well addressed? Others is either partly addressed or no mention at all. And this included the issue of improving soil fertility, agrobiodiversity, use of organic methods and proper ridge management, improving security and access to land and water resources, issues of expanding the area under irrigation, water harvesting and management, integration of climate change adaptation, and also improving forecasting on climate change. Some of these were mentioned in the 3 documents, but majority of the document did not have that. So one of the big gaps that we identified was that there were no interventions to address eco-friendly and innovative production system, and also the issue of mitigation of greenhouse gas emission. Such interventions were lacking. Also, the intervention of safe water and sanitation was also lacking. So those are some of the gaps I identified in that priority area. Next slide, please. So the 3rd priority area under food availability was improving processing, storage, and preservation of food. Again, in review documents, about 44% of them, of the review document, had covered this well. And this included the interventions to do with promoting food processing, issues of flour milling, issues of fortification, having measures to manage post-harvest losses. Also, there was good intervention mentioned about expanding the strategic grain reserve into having a strategic food reserve so that we can expand the number of foods that are there. Apart from cereals, we could also have fruits, vegetables, and other nutritious food, and also the issue of enforcement of regulations. Those are some of the things mentioned, but we identified a gap in that area, and that was there were no many interventions mentioned on low-cost technologies on food processing and handling, and also there was little mention on registration on mandatory fortification of foods. So that was one major gap identified. The 4th priority area was on food safety, and about 8 documents had mentioned interventions to do with food safety, including capacity building on food safety, provision of toolkits on product labeling and packaging, and also certification and accreditation. In actual fact, maybe it's good to mention that we also have a draft of the food policy, food safety policy, which is almost done, but it's still in draft form. It has not been concluded, so that's why we did not review. So it just shows that still there are some efforts to have a policy on food safety. one major gap there was there were no mention of harmonizing and monitoring the enforcement standards on food safety matters. The last priority area there was on women and youth. And out of the 18 documents reviewed, at least 6 of them had talked about anything, something to do with women and youth, especially on gender equality, interventions that were focusing on women empowerment. But a major gap that we identified that most of the documents did not have any interventions to engage youth. Next, please. So this is just a summary of the 18 documents and how they covered the 5 priority areas on food availability. What you see in green is that document really well covered that topic. What is in yellow, I guess, it's partly covered. And what is in orange is that it was not covered at all. Next, please. Again, another summary here of the 5 priority areas. For the first priority area, about 50% covered, but we still have a big chunk, about 33% that never covered. So if you look at the maintenance and improving of natural resource base, that one was, the coverage was very weak. About 72% of the documents never had information on that. Improving processing, storage, and preservation, about 44%. So again, a big number, about 39% not covered. Food safety issues, about 39% not covered. Women and youth also about a third had not covered. Please, next. Yeah, so now this is the second dimension of food and nutrition security, about food access. Again, here we had 3 priority areas according to the checklist. And the first priority area was on expanding markets and market access for the vulnerable groups. And upon reviewing all the documents, about 10 out of the 18 documents had covered this topic well. And specifically, there was some interventions on expanding markets, especially the issue of roads, power lines, and water. The issue of food distribution, there were interventions that had already been put in place. The issue of community involvement, public-private partnerships, access to credit, and others. We also had interventions on market-oriented production, and also the issue of demand and supply linkages, especially linking the school feeding program with the market. That's a direct linkage of production and marketing. But there was a gap in terms of tariffs for unhealthy foods. And also there was a gap in terms of imposing taxes for ultra-processed foods, for example, the sweetened beverages. We do not have interventions that can protect this from being imported within the country. The next priority area was empowering and protecting women and the poor. And out of the 18 documents, about 3 of them had covered that. So that's about 16.7%. And some of the intervention partly covered the empowerment and protection of women and the poor. There was improving security and access of land, water, and technology, especially for women, pastoralist, and child-headed households. And there was also some intervention to increase opportunities for women and youth. But looking at the checklist again, we identified a few gaps. One was that there were no interventions on labor-saving technologies for food production, processing, and preservation. And also the issue of social and recreation facilities for children, which can ease the time for women so that they can participate in other productive activities. So some of those things were lacking in the interventions that were already there. The third priority area was targeting vulnerable population and improving equity. Out of all the review documents, we had 10 of them mentioning or having interventions to do with that priority area. And one of these was on empowering consumers to make the best use of traditional and new products in the market, the issue of controlling trade policies, and provision of nutritious food for all the family members, and especially children. But one gap that we identified there is that there weren't interventions to do with the involvement of men in intra-household food access. Next slide, please. So again, this is a summary of how the documents were addressing the various priority areas. And as you can see, just as I've mentioned earlier, the percentages, what is in green is those that had well covered the topic. You can see the one on empowering and protecting women and the poor, the coverage was very poor. Next slide, please, which shows the summary. So yeah, in the first priority area, we have about 55% or 56% well covered, but 39% not covered. In the second priority area, again, the coverage was very poor, about 66% not covered, and targeting the population, again, about 33% did not cover that topic. Next slide, please. This is the third dimension of food security, which is on food utilization. And we had two priority areas here. One is incorporation of nutrition, promotion and education. And out of the review document, 8 of them had covered this, with intervention proposing promotion of nutrition education in schools, hospitals, workplace, and even within the community. Also promotion of healthy diets, promotion of micronutrient supplementation, the issue of fortification of cereal product. Also, we had intervention on good hygiene and sanitation to control waterborne disease, food and waterborne diseases. But some few gaps were identified. One was on there wasn't interventions that mentioned about advocacy for consumption of foods, and also in the area of safe water. On the issue of women and youth, again, we had about 5 documents which had addressed the issues of women and youth. And uniquely, we had our document, especially the food and nutrition security policy, adopting the life cycle approach, which was very unique because it was addressing the nutritional issues in the whole life cycle, from an unborn child all the way to the old people. So that was quite unique, but we had a gap on those documents not addressing anything to do with the youth in general. Next slide, please. So again, this is a summary. I kindly move to the next slide. Yeah, so you can see how the percent of how the whole thing was covered. In the first priority area, about 44% well covered, about 17% partly covered, but about 39% not covered. On the women and youth, again, almost 56% not covered any interventions about women and youth. Next, please. Finally, the fourth dimension was on stability, sustainability, and governance. And here we have 6 priority areas. And the first one was on governance, and this was to do with the collaboration and coordination with other sectors to address food and nutrition security. And you can see we had quite a number of documents adhering to this. About 61% of the documents well covered these topics, in the sense that their drafting was consultative and also multi-sectoral when they were being developed, meaning that there was a lot of consultation between the sectors or between the different ministries. Some documents had also indicated the status of funding sources, and the mention was that most of the policies and strategies expected to get the funding from government, from private sector, from NGOs, or even from development partners. Some of the documents also had shown some indicative budget for implementation. But some of the gaps here is that some documents just listed the interventions, but they did not show any budget. They did not show even how to advocate for budgets, where to get the funds, and very few address the issue of women and youth. On the next priority area, which was to increase incentives for availability, access, and consumption of diverse and nutritious and safe food, only about 3 documents addressed this. This was very poorly addressed in most of the documents. In the next one, which is on monitoring dietary consumption and access to safe, diverse, and nutritious food, about half of them had addressed this topic. In fact, some of them, actually majority of them, had a monitoring and evaluation framework with the indicators included. However, some of them did not have, and some of those indicators which were listed were not gender sensitive. Just list an indicator, but the language was not gender sensitive. The issue of developing capacity, we had about 7 documents covering this. Then there was the issue of implementation of policies. We had about 12 out of the 18 had an implementation framework. And lastly, on the issue of including the nutrition of food security objectives, most of them had stated the objectives of the policy of the document. May I put it that way? And they had the nutrition, the indicators were present, but most of the indicators that have been put there was at impact level. We did not have the process indicators. Next slide, please. So again, this is a summary of how this was covered by all the documents. Kindly move to the next slide. Yeah, so in the first priority area, about 61% had covered this. When you look at the second priority area, a big percent did not cover that. On issue of monitoring, again, we had about 50% covering that. Developing the capacity, again, more than half did not cover that. And the issue of implementation of policies and strategies, again, about half or a third did not cover that. But in terms of including nutrition and food security objective and indicators, that was well addressed by almost 67%. The issue of women and youth, not well covered. Next slide, please. Now, having looked at all that, we have a few conclusion statements here that if you look at the whole analysis, there's a lot of initiative in Kenya to have the policies in place, policies and strategies in place to address food security. And this has happened over time. Over time, throughout the years, the Kenyan government has always had these documents put in place, reviewed after every other season to improve or to make it better. So that effort has been there. Majority, and especially the current food and nutrition security policy, does address the 4 dimensions of food and nutrition security. That is the availability, access, utilization, and sustainability. That one has been covered in the current document. And as I said earlier, unique to this document is that we have the life cycle approach, which is helping it's sort of more or less putting in place a situation where we're able to address the nutrition status of the whole population. And also the issue of nutrition in emergencies, such that if there is, in case of an emergency, there are strategies or interventions that have been put in place to help the affected population. Also, as you saw from the, I think the 3rd or the 4th dimension, the drafting of this document has been very consultative and multi-sectoral, meaning that right now there is a lot of effort to make sure that there is involvement of different sectors in this, in fighting food and nutrition security, because it's not a one sector thing, it affects different ministries. And finally, we had good number of these documents having the M&E framework with indicative budgets and also with indicative indicators to be measured. Next slide, please. Again, I want to give just a highlight of some of the identified gaps. Remember, I started by saying that there has been a recommendation to use a food system approach when we are trying to identify the solutions to food and nutrition security. So one of the things probably I can say is that most of the document did not fully embrace the food system approach. So there was that disjoint between the production, the consumption, the distribution. So this has not been addressed properly. And it is important that in future, when we are drafting these policies, that the proposed interventions are cascaded at all levels. Also, there was a gap in terms of provision of incentives to promote production of diverse and nutritious food. Another weak area was the issue of coordination, as much as in some of the, when it comes to implementation, there was some disjoint in terms of the coordination. The issue of gender, it was addressed in some documents, but we can still find a number of gaps in terms of the role of youth especially, and also the role of men. And finally, as much as there was mention of budgets in the document, there was limitation in terms of availability of this money, and it was not mentioned in most of the documents. Next slide, please. No, general recommendation that we came up with based on the review is that number one, we need to have evidence-based implementation. As much as we are doing implementation of various interventions, they should be based on evidence. Whatever intervention that have been proposed, there should be some evidence that this is the best implementation we are giving, which is going to support food and nutrition security policy, and especially addressing the issue of the vulnerable groups, including the women and youth. Another thing that needs to be put or to be considered is that we are promoting production, yes, but there are no incentives to this production. So we need to provide incentives to promote production of diverse and nutritious food, and especially the issue of orphan crops, which are very good in nutrition, but often neglected. We also need to include the private sector in development of the smallholder systems. In terms of coordination of implementation of these policies, it would be important to have a national leadership to avoid the gap, or to avoid the different sectors operating separately. We can have a National Food and Nutrition Council where the leadership of this implementation can stem from, have a dedicated budget for this implementation. One thing I realized is that we have these very good documents, but when you look at the implementation levels, it's not known, or it is there, but still it hasn't been done. If it is done, maybe at a very small percentage, meaning the implementation of this document is very, very, very slow. And one of the things that was cited is lack of budget. So if you can have dedicated budget for this implementation, probably this will improve the implementation in future. Also set up integrated monitoring and reporting system within all the sectors to make sure that there is clear responsibility on each sector, who is doing what. Excuse me. We need to focus on women and youth empowerment. And finally, we need to strengthen the capacity building of all food system actors. We embrace the food system approach and build the capacity of all the actors within the food system, and especially the extension people who really support. One thing I realized when we were doing the review is that as much as the policy is in place, there was still a mention that the extension people who are there do not understand the issue of nutrition agriculture, nutrition sensitive agriculture. So we need to do capacity building for these people so that they can understand what does it mean when you talk about nutrition sensitive agriculture, so that they can also cascade it downwards when they are training the other actors. Next slide, please. I did have some quick summary of proposed intervention, specifically under each dimension. So in order to enhance availability of nutritious food, we need to focus on interventions to enhance urban and peri-urban agriculture. Remember, we say that there is a lot of food and nutrition insecurity in the urban areas, yet the intervention mainly focus in the rural areas, but not in the urban areas. So we need to have that in place. Also, intervention to increase credit for inputs. We need to have some innovative approaches for agricultural financing and insurance schemes, which can cushion farmers, especially during the climate shocks. We need to come up regularly because we are still developing, but we still need to continue developing climate smart technologies and interventions, especially those which can help to mitigate the greenhouse gas emission. We need to focus on research on the best practices, and especially on water and hygiene. We need to embrace low-cost technologies for food processing and handling, and also embrace registration that allow fortification of foods, which can enhance nutrition. Also harmonize and monitor enforcement of food safety standards, and create opportunities for youth within the food systems. Next, please. When it comes to access to nutritious food, again, we need to emphasize on interventions that can lead to labor saving, and also engaging women and youth in the food systems. In terms of utilization, again, we need to come up with interventions for capacity building and promotion, promoting advocacy of use of nutritious food, and also promote use of safe water. Finally, next slide, please. To enhance sustainability, we also need to come up with interventions that will advocate for increased budget for nutrition at both national and regional levels. We need to develop implementation framework for all the policies. Realize some of the policies were lacking that. We need to come up with smart indicators at all levels. This will help us in monitoring and evaluation, and also develop proper system for data capturing and storage. Finally, we did have some something for further research. Going forward, it will be important to do some research on evidence-based intervention. Remember, we say that for us to have comprehensive, or to come up with good food and nutrition achievement, we need to bring interventions that have evidence that this is the best intervention that will give us food and nutrition security. So we need to do research on that and come up with evidence-based intervention that can be incorporated in drafting of the policies. Also, we need to do research on sector-wide intervention and align this with within the sectors to enhance accountability. We need to come up with best approaches for funding, and this can include both public and private financing schemes. We need to have research on basic set of indicators to deliver the main food and nutrition outcomes, like which indicators do we put in place that when we measure this, we can say now we have attained food and nutrition security. Also, we need some research on how to empower women and youth, and how we can have meaningful participation of each of these in the value chains. Also, research on the most popular strategies for mitigating greenhouse gases, and this can now be used also when we are drafting the policies. And finally, we need to do some research work on to support the food system governance. This one needs to be articulated so that in future this can be properly embraced when we are drafting the policies and the strategies. And I think that is the end of my presentation. I thank you very much for listening.
Thank you very much, Dr. Alice. That was a fairly comprehensive coverage of the policies, and you have taken us right on the dot. 11 o'clock, 12 in Nairobi. So yes, so a wide coverage. We covered a lot of area there, 4 dimensions plus, and also the priority areas as to how the current policies are covering these different priority areas and where the gaps are, and also recommendations on how we can address this situation. Interesting to note that, yes, even if we did 18, looked at 18 documents, you mentioned that there's still quite a few more, but the impression one gets is that there's such a multiplicity of policies and strategies, all to some extent addressing to different levels the issues of food and nutrition security. So one wonders to what extent these policies, are synergistic or they're harmonized. So that's probably a question that we will want to discuss, not necessarily targeting that question to analysts, but I noticed that we also have participants, some of whom may be involved in policy formulation, working for different government agencies, but also some partners, non-state actors. So yeah, this is the picture. So we're going to open up for discussion. We have quite a good amount of time. Let's see what the demand is for that. So I'm watching out if anyone has any intervention they would like to make. Please feel free to come forward, raise your hand. If you check under there should be, I think it's under reactions. Yes, you can raise your hand there. If you click the reaction, there's an icon there where you can raise your hand. If I can't see it, just feel free to come in and make your intervention.
Yes. Can I make some contribution?
Yes, is this Japheth?
Yes, Japheth, yes. I'm
okay,
Japheth.
so it's you can go ahead, just indicate which institution you are affiliated with, just so we have an idea. We might actually turn some questions back to you as well. Please go ahead, Japheth.
Yes, thank you. Alice has made a very good presentation. But what I can say is that some of these policies are in response to the global and regional policies. And some of them are a bit ambitious, and they are made in response to these global and regional policies like the SDG and the Agenda 2063. But now when it comes to implementation, some of these projects, because in Kenya, for example, the budget allocation to agriculture is very low, and that's why it brings the problems. And some of these policies and specific things also comes to talk. And more important, a framework or to follow up or track how the projects are being implemented. So they are not keenly addressed. And those are some of the issues. Some of these policies were implemented.
Sorry, Japheth, you're breaking, so it's difficult to hear you properly. May I suggest that maybe you put some of that information on the chat, because your connectivity is quite a challenge, I think. But what I picked up there was a couple of things where you said we have very ambitious policies, and in most cases we we tend to respond and to try to align to global frameworks like, SDG as an example, SDGs. And yet, when it comes to the reality on the ground, we are not able to provide, budgetary allocation for implementation. And also we are not able to track implementation, which I think confirms what Alice was presenting. So if there is further things you wanted to share, which we didn't pick up, those were the only things I could hear before you sort of started cutting off. Japheth, please feel free to add some more onto the chat, and then we can pick that up. And also if you have a specific question, then we can address it. So I'll move on to ask my colleague, Njongen Tlenyoni. Your hand is up. Please go ahead.
Thanks, Simba. Very interesting presentation, Alice. Thank you so much for that. I think, there's that ambition that Japheth is bringing up. But, there's that ownership as well. When we produce these documents, they are national documents that we produce, maybe domesticating the continental as well as the global proclamations. So I think there's that responsibility to take that to follow up and implement. I think that's what Alice is highlighting. So is it that when we're developing these policies with the participation, as you mentioned, Alice, the participation of different stakeholders, I'm thinking that there's that idea of let's present this in a way that is acceptable to us, and then follow those. So maybe there's that, I don't know whether Japheth can explain more around that part. The other thing is that Alice, we mentioned the 18, and there are more policies that we could have looked at. I think these ones are key. And Simba highlighted the issue of synergies. Is there a way that, looking at the NIPE, for example, we've got the 2019-2024, which would be the second generation NIPE. Would that then mean that looking at that NIPE, it may be covering for some of the gaps that are there in other policies? Is there a way that we look at the analysis in that way, so that those gaps that were highlighted highlighted earlier, or that were there in the other policies and strategies earlier on, are then being covered by the latest plans and strategies that the country has developed? Thanks, Emma.
Okay, thanks, Sanjo. We'll pack that and maybe ask Alice and anybody else to come in and respond to that. Let's take a couple of more questions or comments. Do we have any other comments, colleagues? Do we have, yes, Prof. Hetty, please go ahead.
Thank you. I just wondered, if we look at the variety of policies and programs that are in place in Kenya, then it is as if what strikes me most is the undernutrition of the children that is still so extremely high. And what can we do so that those children are actually also the beneficiaries of these programs, to decrease undernutrition at that level? Because we know that if you are undernourished as a child, you also grow up, you never actually realize your full potential as an adult. I don't know if she wants to comment. Okay, thanks, Prof. Hetty. Do we have among the
colleagues from Kenya. Do we have anyone from Ministry of Health or Ministry of Agriculture in the audience?
Yes, I am here, Jane Wambugu.
Hi, is this Ministry of Health?
Minister of Agriculture, Kenya.
Minister of Agriculture. Yeah,
Yeah, and
maybe.
I can see other colleagues around. There are quite a number.
Ah, great. So
Yeah,
I may have specific questions for you, but maybe you may want to comment because I know that agriculture and health are sort of the lead ministries when it comes to food and nutrition security issues. Do you want to comment on this presentation or anything in particular?
Thank you, Alice. Thank you, Siba, for the presentation. It was quite comprehensive. And there are a few areas that in the presentation about the policies and strategies. There is a policy and a strategy I did not find. I thought maybe I came in because I was changing my gadget. I thought I didn't read exactly though the policies. One of them is the Kenya Nutrition Action Plan. There is a policy on nutrition sensitive. There is a strategy on nutrition sensitive agriculture developed in response to the Kenya Nutrition Action Plan, which speaks more from a health perspective. But for agriculture, we have Kenya Agri-Nutrition Implementation Strategy 2020-2025. I didn't find it mentioned. And in it, some of the questions that have come up on nutrition or some of the areas that need to be addressed further, interventions that don't seem to have been addressed are basically in that document. So I don't know whether it was an omission or it was not in the one of the documents that was reviewed, because under food utilization, the promotion and the advocacy consumption of adequate micronutrient foods, it's really discussed in that document. However, the document is a national document, and in Kenya, agriculture extension is a devolved function, meaning though it is a national policy document, there is, for us to achieve that food utilization area at the promotion, there is need for the counties to domesticate that. And this is something that is going on. Another area that also came out as an area that need to be addressed is on nutrition sensitive agriculture. It was mentioned in the study that it is not covered well, and it's true. But I think the current work that is going on together with the Food and Agriculture FAO, it is to have a national package on what is nutrition sensitive agriculture and food system, and it's already it has been actually in the final launch stages. I don't know whether some work going on, interventions that are going on, was covered in the study, because I didn't hear that one coming out, and it started way back in 2020. This is an activity that started 2020, so it's not a new one, and it's only the document that should be on the table. The issue on availability, the issue of urban and peri-urban agriculture that I saw in terms of areas of further interventions, we already have, there is an urban and peri-urban agriculture strategy. It is there. Maybe it is the implementation of the strategy. I don't know whether that document came into play because it's already there. And also there is a program coming in on urban and peri-urban agriculture. But the strategy speaks of some of the gaps that are coming out. So I think maybe because of lack of the review of some of those other documents that are speaking towards also on building to other interventions that are already heading. For example, the Food and Nutrition Security Policy Implementation Framework was 2018-2022, meaning maybe the next step should be a review on that, because the time frame for food and nutrition security policy implementation framework is over. However, the period is over, meaning what we should be going on is reviewing, because in that document, and I found it coming out from the study, it is the issue of the council, the establishment of Food and Nutrition Security Council as a coordination mechanism. So since the period between 2018 and 2022 is over, maybe what should be coming out is the review of that policy implementation framework and how the coordination now can be addressed, because it was never instituted, but it can now come up. So maybe I can leave it at that. Maybe my colleagues can also build on that. But before I leave, it's also good to bring out the issue of private sector engagement and the investment as a way forward. It's already going on, because we have a number of initiatives, like for nutrition, like the flour blending initiative, which has a very clear private sector engagement focus. And so that when we are talking about blended flour and how they can be fortified and blended for nutrition, it's a very clear initiative in Kenya, and it's really also touching on schools and how they can also have blended and fortified flour for their meals. So maybe I felt a gap of some of the already policy document that are speaking on nutrition, because I had agriculture and nutrition docket in the ministry, and some of the things that have come out from the study are correct, and they are actually what we are really engaging in and intervening on, so that we are able to bring out the policy in action. I think my colleagues can add on to that. I see Rusweti, I see Kidama. Maybe they can say something about Rusweti can bring out the 4K, the youth involvement aspect of that. Thank you.
Thank you so much, Ms. Wambugu. That was very, informative, and I'm sure Alice is taking note of that. We probably would want to look at those documents and just fill those gaps before we finalize the study. I think that is a great contribution. Let's hear if there are colleagues from either agriculture or health who may want to add to what Jane shared.
Can I add something?
Yes, Jafet.
As my colleague has said from the ministry, the policy issues at national level are well articulated, but now the devolution part, devolution to that county level, the counties probably there's still a challenge in terms of domesticating those policies and implementing them on the ground. I don't know what they can say about this.
So are you asking colleagues from agriculture to respond to that one, Jafet?
Exactly. What I'm seeing is one of the challenges that are inhibiting the well implementation of some of these policies is non-domestication at county level, because the governance is developed up to the county level. But the county government embracing some of this policy has been a challenge for quite some time, from 2013 up to date.
Okay, thanks, Jafet. So just in case, just so that we don't lose track of the issues that have been raised so far, questions that we still need to address. There was the issue of ownership. I think it's probably tied in with Jafet's question, which is to do with the devolution of these policies and strategies to the counties because of the devolution of governance. So, yeah, to what extent is there ownership of what are largely national policies? How are these cascading to the counties? What processes are in place? But also there was an issue about the synergies of these policies. I mean, there's one of the reasons, of course, we tried to be as comprehensive as possible, but of course we missed some. And that's because there's quite a large proliferation of these policies. I don't know what the solution would be to sort of harness these policies and bring them together so that, yeah, one-stop shop, so to speak, rather than go all over the place and talking to different ministries, which at the end, we are all trying to deliver improved nutrition. Prophet's question was, yes, we have all these large number of policies and programs, and yet Kenya is still experiencing high levels of child undernutrition. How can children benefit from these programs? I don't know who wants to tackle these questions so far. Maybe I'll give a chance to Alice to comment first if you can. Otherwise, maybe we can go back to colleagues from agriculture to try and address some of these issues, as well as Minister of Health, if there's anyone. Alice, do you want to give some quick comments to those?
Yes, Prof, thank you. I want first of all to say thank you to Madam Jane for her contribution. I've noted the gaps. Yeah, some of those documents, I did not review them because I didn't come across them, but probably I'll follow up with you. If I don't see them, then I can have a look at them. But that was very great contribution. But as she said, some of the documents are coming to an end. So what needs to be done is to review and see how much have we been able to achieve. And maybe that level, we haven't done that. In terms of synergies, I don't know who asked this about the NAIP and how they are connecting with other policies. What I know is that this national food and nutrition security policy, it's an overarching document. It tried very much to incorporate the previous policies that were there. So like we have one now big document covering different ministries. And some of the strategies here, like the NAIP, the ASDGS, the food and nutrition security policy, they are all aligned to this food and nutrition security policy. So for once, I can say that they are all like sort of answering most of the interventions that have been proposed in the food and nutrition security. But I do agree there are other policies. When I mentioned that there are other policies that we did not review, I did not mean that they were supposed to be here. Those are other policies maybe answering to other issues, but not food and nutrition security policy. But if I missed any that is answering to this food and nutrition security, I'll be on the lookout to see what it is, and then we can incorporate it. I don't know which other question I can be able to answer there. And I also appreciate my colleague, Dr. Wanyama, for his contribution. Yes, and I do agree that some of those policies are quite ambitious, and probably that's why we've not been able to fully have a comprehensive implementation on the same. So probably I'll ask if there is anybody from the ministry who would want to respond to that question of undernutrition of children and how they can benefit.
Okay.
Hello, Ali.
Yes.
Yeah,
yes, Jane.
Yeah. Yes, Iba, thank you. I think because the issue of nutrition is under my docket.
Okay.
Yes, maybe I'll give it a. I can say what we are doing in matters of children and nutrition. As I had mentioned earlier, we have a document. We realize the interventions that are going on in the country. There is a lack of a package that we can monitor, and we can be able to say that actually we are intervening in all these areas. So I had mentioned that we have nutrition sensitive agriculture package. It's a package in the sense that it is speaking aloud food system, nutrition sensitive agriculture and the food system package. So it has 36 case studies of how we have done it in Kenya before. It forms part of the training package. And this is the package we are sharing, because these case studies, we have gotten all of them from the partners, from our institutions like Kenya Agriculture Research Institution, all the partners in the nutrition safe arena in Kenya. We requested them to all bring the case studies. What were they measuring to say that they intervened, whether they were intervening on children or that they were intervening on the youth. Whichever program has come in the country and there was an intervention on allowed nutrition, in agriculture. We packaged them. So we have that package. It's I don't know, because in the package we reviewed it together with all the academia was involved in the review, and also the extensionist, and also those who deliver on it. So what I'm saying is, this is a document that we are in the final stages of. Actually, it's at design stage. We have even pre-tested it in 26 counties to see whether they understand how to train in nutrition-sensitive agriculture. And this one on intervening on children is one of the topic. It is actually nutrition in the life cycle approach. It has all those nutrition messaging and how to intervene and how to measure what indicators should be to be measured allowed that. So I think we realize the gap. You are right, we realize we have that gap. We don't have a centralized package on what that can speak even to how we are intervening on nutrition, whether in the life cycle approach. So I think once now that we have loaded in 26 counties and the document is out, then we can see how it is impacting in terms of interventions and the delivery at the county level. Yeah, yeah. I think I don't know whether I've answered that question, because it is a gap. We have had that gap for a long time in matters of nutrition in agriculture. Thank you.
Thank you, Jane. So yes, you're talking nutrition sensitive agriculture package. I imagine this is targeted at your agriculture sort of frontline staff. To what extent do these packages include collaboration with, say, community health workers, Ministry of Health, who are also trying to reduce malnutrition, but coming from a different angle? How much are you sort of collaborating at the sort of field level?
Thank you, Siba. What we have done, we are working together with Ministry of Agriculture, Ministry of Health, Ministry of Education is also involved, because it's a package for all of us. What we have done in Kenya is when we talk nutrition, we don't work nutrition alone. Anything, whether it is nutrition from the healthy side, the agriculture, whether it's a nutrition specific agenda, we also collaborate with the nutrition from agriculture. So this is a package that has been developed by Ministry of Health, Ministry of Agriculture, FAO, WFP, and other partners that we feel it is important to them, like USAID programming. So it's a package for speaking for the country in terms of the coverage. There is no duplication of activities or interventions with those the Ministry of Health is doing. So what we are doing at the ground level, when we get to the county where the intervention is taking place, we also bring the county nutrition coordinators on board. When we say that we have trained 26 counties to implement the document, the people we have trained is the county directors of agriculture, the county nutrition coordinators, and any other partner, and also the agriculture team, that is livestock, crops, and also fisheries team, part of whom we have trained in the county. We have targeted, like, we take a package of 5 different personnel or different kind of department at the county level. At the national level, the same. We work with the same team. So this is what how this is how we are handling it. But if there is a gap you feel that we should improve on, we are ready for that. Thank you.
Thank you so much. We've got a few other questions before I take questions from the floor. These came on the chat just so that we respond to those questions. One of the questions from a farm says, if level of poverty, food and nutrition insecurity have continued in sub-Saharan Africa and also globally, what are we doing about food wastage at primary, secondary, and tertiary levels of the food chain? And secondly, in the priority area of improved processing, is there legislation on post-harvest loss management? I hope, Alice, you caught those two questions. So it's food wastage, along the sort of food systems value chain, but also secondly, is there any legislation on post-harvest loss management? In other words, do we have legislation that helps to implement some of these strategies? Then another comment from Matilda is, are there programs and strategies to change people's perception about gender roles in food production? In some parts of Africa, food production is perceived as a sector for women who are grappling with access and control of land, access to modern technology and other inputs. I'm wondering if there are specific policies and programs which address these issues. So this is back to the issues of women's role in agriculture. Let me see, there's a few others. One of the questions from Swilanji is about change in governments, which is a topical issue now that Kenya is having elections in a few weeks' time. Change in governments more often is accompanied by change in priorities. This situation tends to make implementation more difficult in terms of switch over to entirely different priorities and objectives, which require new organizations, personnel, resources, technology, etc. Now, this leads to abandonment of many policies. So is there a need to strengthen institutional continuity rather than political? That's quite a mouthful of questions. I'm not sure whether Alice can answer some of these, but maybe pick and choose. We can refer some. I'm sure our colleagues from agriculture could maybe address the issue of changes in government. Does this happen across all levels, especially operational? Do these policies remain in place, whether there's a change of government or not? But in the meantime, maybe Alice, you can address the, whichever questions you can address, then we can look at how we tackle the other remaining ones. Alice?
Yeah, thank you, Simba. I think that question of food wastage, I'll leave it for the floor to discuss, because I think it's a hot issue, because it's true there's a lot of food wastage, although there's still poverty. So I'll not respond to that. But then the question of registration of food post-harvest management, I think in one of the documents there was a mention of post-harvest management, but I also raised it as a gap because it was not comprehensively covered. So I've raised it as a gap there, but in the food and nutrition security, there was a mention of how to manage post-harvest losses, but there wasn't mention on registrations on how to do this. So I've raised that one as a gap. On the issue of perception on how to change perception, that's gender perception, I would respond by saying that there's a lot of effort in trying to mainstream gender in agriculture, even in research. So there's a lot of training to try and bring this transformation so that people do not have that perception of gender is women, but just to mainstream in all the activities, including agriculture, including research, including any community involvement. So there is a lot of effort on that. But of course, changing perception about gender can take a while because some of it is very, very deep-rooted in the community, depending on which community you are dealing with. Policies to address women access to RAD, this has been extensively mentioned in the food and nutrition security policy and even in the strategy. So I think, it's in the process of being addressed. There is a mention of that in the food and nutrition security policy. And I think the rest you said, we can leave it for the floor also to discuss about the change of government.
So you mentioned the issues about changing perceptions, gender roles, and the role of women. One of the things that being an African country, to what extent sort of, societal, maybe cultural norms acting as barriers to achievement of nutrition outcomes, especially for children and women. Do you want to comment on this? Is this something that was covered by the policies, realizing that we do have these cultural barriers and they actually need to be tackled? Otherwise, if there's no strategy dealing with that or some activity dealing with that, then it can continue. We can provide, improved supply, But if at intra-household level, there are challenges in terms of food access and allocation. Do you want to comment on that one? Or anybody else can come in there?
In the review, I did not come across any strategy that is working on the societal norms. But what I've explained is what is happening in day-to-day, like in when we are doing training in agriculture, when you go with the farmers, we have activities within our level of research, even extension, to train farmers about gender roles, about gender transformation, involvement of everybody in the community to see how we can bring out these, or we can try to educate them because of some of those very negative norms that do not allow women or even men participation in some of the activities. So it's not mentioned in the policies, it's a gap, but it is happening in the activities that are going on.
Okay, so let's see if anybody would want to respond to the issue of continuity of policies, strategies with changes in government. Is this a problem in Kenya? Does anybody with some knowledge of this want to come through?
Yes.
Yes, Japheth.
Yeah, the issue of change of government was a reality. I remember the issue of food security having come up very well in the Big Four agenda, which Dr. Alice Muraga as well articulated. But down the line, change of tactics, it was relegated to the background, and other issues now came in. And probably we hope that in the next 30 days or so, when we are likely to have a change of government, such issues will come up as priority areas. That's my comment.
Okay, so it's a reality. So is there anything that people can do in practice? Do you see some real big changes, or as you call it, maybe a change in tactics and not so much change in objectives?
I think the issue is to disaggregate the key issues from political arena, which is sometimes very difficult. Yes.
Yeah.
Politics being tied with policies and not well implemented as time goes by.
I can contribute to that. I'm Lusweti from Ministry of Agriculture.
Thanks, Charles.
Yeah, with the change, of course, there will be different kinds of alignments depending on the pronunciation of whoever comes in office and his or her government. But when you look critically, what underlies those areas that come up with the new leadership, we'll find they are almost the same things that are inherent with the issues about food and nutrition security. The issue that might just come out loudly is the prioritization. If the leadership will come and focus on, for example, issues of infrastructure, then we'll see even that influence their budgetary allocation towards that sector, as opposed to what we have maybe as at that moment, the issue of food and nutrition security. So there will be that issue of change, yes, but critically sitting on these technical desks and what we have as work at hand, then we'll find they are merely the same things, just that the attention of that leadership might not be that substantive enough to bring about the change that we'll want to get or see as per what we've laid down in the previous kind of system. So that is what I have seen come up, because when these, for instance, these outgoing government came in, it talked about the Big Four agenda, and all this is what we've been doing. But now, when it comes to allocation of funds and all that, you find we had some areas that were looked into more than what we were doing at that time in terms of coming up with the food and nutrition security. That's what I can contribute.
Okay, thank you for that. I guess it all depends on the election manifesto. If a party that comes into power promises certain things, they need to be seen to be implementing those. And as you say, priorities may actually change, and this will affect budgetary allocation. There were a number of other questions here. I'm not sure it says Alice Murange to everyone, but I think maybe I don't know if there's another Alice here, but it says one suggestion in your slides for further research is research on the basic set of indicators to deliver on the main food and nutrition outcomes. One is left to wonder, what are the food and nutrition outcomes they set out in the current policies, strategies? In other words, are these not providing enough guidance? And then secondly, are there specific policies which you reviewed which use the traditional levers? Here, we're talking of policy implementation instruments such as taxes, subsidies, and other fiscal measures, and whose outcomes are easily amenable within some approaches such as computable general equilibrium. I think this is, I hope you're an economist, Alice. Or could it be said that these policy documents are not specific on such levers? So did you come across any examples of where government is proposing using, taxes or subsidies or any other fiscal measures, maybe tax breaks, things like that? So there are two questions there. One is on the indicators. In other words, what are the food and nutrition outcomes indicators set out in the current policies or strategies? In other words, are they inadequate? And secondly, the use of specific policy measures, especially fiscal and economic ones. Any comments, Alice?
Yeah, on the second one, it did not come out in the policies and the strategies I reviewed. And that's why in one of the gaps I identified and I said we need to come up with some interventions which talk to the policy, the taxes and subsidies. That did not come out well. But in the first question on indicators, as I said, most of the document, or can I say in the food and nutrition security policy, the indicators that were there are quite broad, most of them at impact level. And that's why at the end, we are saying we need to come up with very specific indicators that when you achieve, you can say, yes, I had sought out to get this number of people maybe having this nutritional status, then I can say I've achieved. But the currently what is there, it's a broad set of indicators. So we need to make them more smart and achievable.
Okay, and also if I take an example of stunting as an indicator, you find that that is an indicator which doesn't respond very quickly. It takes a long time to respond. And some of these programs may be short-term to such an extent that we probably need some intermediate indicators like, things to do with consumption, dietary diversity, which would feed into that long-term indicator so that we can see that, yes, we may not have made differences to stunting, but we've got drivers of stunting which are moving in the right direction. I hope that that helps in terms, that's why we talk of impact level versus your intermediates and the lower level indicators, just the ones that you use for tracking what is happening on the ground. So I think when experiences from elsewhere, I know that the AU, AUDA, NEPAD, they are also looking at and FAO supporting the second generation of national agriculture investment plans, where they're putting a lot of emphasis on the use of these levers, the smart subsidies, taxes, and several fiscal measures, which are supposed to create an enabling environment for the private sector to then come in, and also things like risk sharing and those kind of things, so that private sector would find it more, easier to come in and contribute along the agriculture and food system value chains. So this is an area I think that needs to be explored to see what has worked. We know some of these have worked well in places like Nigeria. I know that Ghana has been pushing this for some time. I think the last 3 or so years, based on their National Agriculture Investment Plan, they've also incorporated these levers into their policy processes to make sure that there's adequate funding. Also things like dedicated agriculture funding funds, that also helps. So yes, so I don't know, does anybody else want to come in? We still have about 10 or so minutes to go. Anyone? I see that there was a question from Moses. Yes, Jane?
Thank you. I think, I just want to comment on the indicator, the issue of nutrition indicators in nutrition sensitive indicators. We have looked at this, and it has been an area of a gap, a very big gap in agriculture, because the kind of indicators we have, issues of stunting, issues of all those, they are broader than what agriculture can cover. So together with the Kenya Bureau of Statistics, we have looked at the indicators that can come up under the new program we are having of National Information Platform for Nutrition. It's called NIPIN. We have gone through the first phase. We are now we are by the end of the year, we should be going in the second phase. And what we have been grappling with is, first of all, to understand what each indicators we should have, both for nutrition specific and nutrition sensitive agriculture, especially for agriculture, because we find there is a gap on what kind of the indicator, the process indicators that agriculture can be more informing. Because alone we cannot measure stunting. We cannot, an indicator like stunting cannot be measured from agriculture. So what we have done is we already have a template as a country for nutrition sensitive agriculture and the indicator. And this is something we have done together with the Bureau of Statistics and also the Ministry of Health and the Ministry of Agriculture, together with our partners to really look at what indicators that should be measured in this. And since Kenya is now in the our medium-term planning we realized when we looked at the medium sectoral plan for medium-term 4, that nutrition actually does not come out because of the issue of even how it is to be measured, even at the sectoral level. And in sector, I mean, we have agriculture, we have livestock, we have fisheries, we have the Ministry of Land, and we also, that is the sectoral planning. And this is where we should now have nutrition sensitive, domiciled and actually planned for. But now that it isn't there, and one of the gaps is the indicators that should measure that, we are in the process actually of having nutrition integrated, like just the way we talk about climate smart agriculture, and nutrition should also be measured in, and that's why it was missing in those policy documents as earlier agreed. So this is what we are already now planning for, that at the MTP4, we are discussing on how can we have this with together with our planning department. That is where also the resources are allocated, and also together with our partners who want to see even the councils established and all that. And the review of even the implementation of these policies should be planned for at the MTP4, and capturing the food security as well as capturing nutrition. So the issue, I want to agree with you, the issue of indicator is a bit hazy, but I think we already have the first set of indicators we should be measuring. It has been a process over a period of time, but right now we can say with our Kenya Bureau of Statistics and also the program of National Information Platform for Nutrition, that right now we have some indicators that can go all the way to outcome. But starting from the process. Yeah, thank you.
It's good to know. Would you include these nutrition outcomes and indicators in the performance sort of accountability for the agriculture staff?
Yeah, that's why we wanted to feature the MTP4, medium-term plan 4. Because if it's not allocated resources, and if it is not allocated even indicators for measuring, even pushing it down will not make any sense. So the first point is to have it at a medium term flow. And it can only appear there if we have already agreed on indicators, both sectorally and intersectorally. Intersectorally is also health is not replicating the same indicator. So the planning team also have the Ministry of Health coming on board so that we don't duplicate already what is in the health, and it doesn't. And also the development of concept addressing that, the concept that can come in to bring out that is also an area of capacity building, because I think that's what we have been lacking. And when the planning comes in place, we are not able to bring it on board. Maybe that is what should also be brought out in this study, the capacity even to bring out some of these things at the point of planning and resource allocation.
Yeah, so capacity for planners, and just to make them aware, because if you have a planner who is only focusing on agricultural production, maybe the sort of production, productivity, and the economic side, without really looking at the nutrition implications of those plants, then you are going to have those gaps anyway.
Yes, you have that gap. They don't, and actually they wonder, what is it? Why are you saying it's left out? What is left out? And we realize it's a capacity gap.
Yes, no, it's good to know that you are already aware of these issues. And I think there was one last question on the chat, which I didn't really articulate, and we have a few more minutes. It's from Moses Nadiope. It says, water is a bearing on urban agriculture. Water for production is a major impediment to the urban poor communities to participate in urban agriculture. Is there any consideration under these policies to address this issue? Maybe a quick comment from Alice. I know that you mentioned that urban agriculture was probably a gap, but do you want to comment on that one, or maybe just confirm what you presented, Alice?
Yeah, I'll just say what I presented, that there is a mention of expanding urban agriculture, but not about the water use. But in general, in the policies, there is a proposal for expanding the area under agriculture. It doesn't mention, I mean, not under agriculture, sorry, but the area under irrigation. So it doesn't mention whether it is at the rural level or at the urban level, but that's mentioned that to achieve food and nutrition security, we need to expand the area under agriculture.
I know that in a lot of
under irrigation,
in many countries, the issue of urban agriculture was sort of shunned even by, the lawmakers. They had a lot of bylaws and all sorts of things prohibiting or limiting urban agriculture for various reasons. Maybe they didn't want to ruralize the urban areas. Is this a challenge in Kenya? Or can people freely practice urban agriculture?
Hello, maybe just to comment that I said there was we have an urban agriculture strategy.
Yeah.
And it was developed to recognize also those challenges, and in terms of issues of land access, issue of water availability, use of technology that can be used in urban agriculture, as well as the technical capacity, the interventions that should come on. So there was the issue of the policies, RAD policies, urban planning, all that were some of the gaps that were noted, because in the current urban planning does not recognize urban agriculture, and some of the way even the RAD is continuing being subdivided and actually change of agricultural RAD to urban setting, some of these are actually prohibiting also agriculture farming. So urban farming. So that is what the strategy addresses, all those. And the strategy also addresses the interventions that should be undertaken in terms of also consolidating the idle land within urban setting. The idle land in this case is like government land, and also those land that the railways that is idle, and what can be done to do urban farming. So the issues of water is really part of it.
Okay. All right.
Yeah,
thank you very much.
For,
Yes, sorry.
For the expanded irrigation, Actually, that is under the STGS. It talks about there are schemes that have been abandoned. And when you look at what needs to get into rehabilitating them, then the thinking is that if this can be prioritized in the planning and all that, then we'll find we have an increased area under irrigation in addition to what is already going on. So the target is mostly not in urban areas, but in those rural areas where we have abandoned schemes that just need some bit of rehabilitation to make it to make them actually viable for food production. Thank you.
Okay. Thank you. All right. I think this will bring us to the end of our discussion, unless there's a burning issue. If anyone has one last point they may want to raise before I ask, we move on to ask my colleague to kind of sum up and give us the way forward. Do we have any last comment? And before we move on to invite my colleague, Dr. Njo, to come in, may I just request that we put on our video cameras just briefly so that we can capture the participants. This is kind of in lieu of a group photo. If we can just put that on and put our best smile, and Kanto can go ahead and take the photo of the participants. If your bandwidth allows, please activate your video. Thank you. Let us know when you are done, Kanto.
Yes, Prof. Yes, thank you, everyone. Yes, I'm done. Thank you.
And thank you, colleagues. So, Joe, I don't know if you are ready to come in and sort of give us more like a summary of what has been coming out of our discussions. I know that's a tall order. This is like trying to fix a running car, but I'm sure you're up to it. And then anything that you think we should keep in mind as we go forward. I know there was one issue, which was some gaps in some of the documents we didn't have sight of. That's obviously something that Alice will probably need to look at. So, Joe, please, the floor is yours.
Thank you very much, Simba. I think the discussion have been quite the situation on the ground, the environment, the enabling environment to ensure that we have solid food and nutrition security in the country. So that has been enlightening. I think there's evidence that shows that there's a lot of work that has happened in the country in terms of building capacity for food and nutrition security. However, there's still a number of gaps that are being addressed, and the other gaps that need to be addressed as well in terms of building that capacity. We have a number of key recommendations that are coming up from the presentation as well as the discussions that we've had, and some very interesting insights. So I'll try and cover what I can with the key recommendations, and then hopefully that will also cover us in terms of informing our way forward. How do we then address some of these gaps that that have been highlighted? So the first part is the evidence, because without the evidence, we are not able to then address adequately and effectively address the challenges that are there on the ground. So there's need to generate empirical evidence in the terms of what the actual gaps are when we want to build this capacity for food and nutrition security. So what are the gaps? And then the other part, which is critical, is then translation of that evidence into policy options. And there's that interesting point that Jane presented in terms of you need to equip the planner, the policy maker, with the evidence that will then help them in terms of talking to the investments that need to be secured for food and nutrition security. So translation of that evidence is very critical. One of the gaps as well was the issue of advocacy. When the evidence is available, how do we then ensure that it gets to the right places and it's then taken up for decision-making in terms of policy, strategy plans, and practice on the ground. The second part is also promotion of diverse and nutritious foods, looking at indigenous foods and orphan crops that are there. Think about the incentives, incentivize their production and their consumption, so that our food systems are really representative of what who we are, and there's that diversity, and the nutritious foods are then covered then. So think about those incentives. And then the third part is the encouragement of participation of different stakeholders. And one that was clearly highlighted was the private sector. How do we bring private sector into the conversation? Because it's very important, and more often than not, we need private sector to be part of the conversation and to implement some of these strategies that are coming up. But there's that disconnect in terms of creating avenues, effective avenues for private sector to participate, to invest and to participate. And so bring up that instrument-based, the NIBES, the approach that has been done with the NIBES has been very important and useful. And hope there are a number of other strategies that we can come up with as a country on bringing in private sector. And there was emphasis also of the National Food and Nutrition Council being established, being funded, ensuring that it has an important role to play in terms of coordinating the country activities for food and nutrition security. So that leadership structure being very important in going forward. Then there's the monitoring and evaluation system that needs to be established, and with clear responsibilities for the different stakeholders. What role are the different actors playing? Needs to be clearly articulated, and this has to be an integrated system that allows for clear monitoring and tracking indicators and activities. So which stakeholders should be providing which information, by when, a clear structure. We need to focus on that. Then coming to women, the issue of gender, women, men's roles, as well as the empowerment of youth to contribute to food and nutrition security. I think that's a gap that was glaring in our strategies, in our plans, in our policies, and it's something that we need to strategically invest in and promote. And there's work that is being done, but there's a lot that we need to emphasize on that area. And then also there's the issue of building capacity. This is capacity, and you realize that in all the different parts of what we need to do going forward, capacity keeps coming up in different areas. So there's capacity to generate the evidence that is required, to translate the evidence that is there, to inform policy processes. And there's a capacity, technical capacity as well, that is required by the bureaucrats the policy maker when developing those policies. How do we then ensure that how do we ensure that we support the policy makers in decision making? How do we ensure that we don't neglect the policy makers when we're thinking about capacity needs? It's not just the farmer on the ground that needs the capacity to produce well, but all the policy, all the stakeholders across the value chain. There's the government officials at the ground, the extension officers that need to also appreciate the issues, especially when it comes to nutrition targets and indicators. There's that investment that needs to be done in terms of building that capacity. And so with capacity as well, we need to also invest in generating that evidence, highlighting where the capacity gaps are. And so we've got to apply ourselves in that and get that clear picture so that we address clearly the issues related to capacity. And then there's the issue of basic indicators came up as well, but that's linked to evidence. We need to have those clear indicators so that there's investments, and then this leads also to the budget allocation. Budget for implementation is a challenge, and there's a glaring gap there. So without a budget, we will not implement these. We will not have strong systems or outputs. We will not get the outputs that we require in terms of food security, nutrition security in the country. The last part is on societal norms, the behavioral change that we need to be thinking about as well as we are focusing on this. So basically, Simba, I think that those are some of the key issues that I managed to get and take note of as I was trying to scribble a number of things here. But yeah, I think the issue of capacity becomes really central in the way that we then focus on having this rigorous food and nutrition system. Those particular gaps that I identified, both from the state and non-state actors, it's something that we need to then focus on, paint that picture, and then ensure that we provide the support that is required for the different stakeholders across the value chain. Thank you so much.
Thank you so much, Dr. Njo. Thanks for summarizing a very sort of rich wealth of knowledge from that presentation by Alice. So thank you to everyone for your time. I would just like to thank specifically our presenters, starting with Dr. Chilidzi, Fanapan CEO, Prof. Hetty. Also want to thank Alice for conducting the study and sharing this information with everyone. To thank colleagues from the government of Kenya, especially Minister of Agriculture, who gave us some insight on things that are happening on the ground. What is clear that's coming out, I think, is that there is quite a lot that's happening. And it's sometimes very difficult to know what, for the right hand to know what the left hand is doing. So which really calls for improved coordination so that we know exactly what's happening, but also the issue of domesticating a lot of these initiatives at the county level. I think there's a lot of work there that needs to still happen. And it's gratifying to note from what Jane was sharing, that you are very much aware of this and you are working with the various partners across ministries, development partners, to try and come up with a unified approach to some of these challenges. So yes, thank you so much. So I think the work is really cut out for us, all the players in this space, that the demand is so high. As Prof. Weheti said, there's so much activity, but the children are still, we still have high malnutrition levels, particularly among children. And what it means for those children is that they basically sentenced to a life of poor performance, because if you are left behind when you are young, it's most unlikely you are going to be able to catch up as an adult, because also your mental capabilities are affected. So colleagues, thank you so much for your time. Thank you for the contributions. And I would like to say this brings us to the end of our roundtable webinar. We just want to acknowledge that this has been a great participation, and yeah, let's bring this to a close, and have a great day, Fela. Thank you, colleagues.